tomorrow, probably that will create the maximum or the largest amount of data of tomorrow's world. Now, staying with that is, I would say, the definition of big data. Again, different people define it differently, but for me, I see the same three aspects: the volume of data, the variety of data, and the velocity at which the data is being created. But then when I look at it from a business analytics or even technology point of view, the volume really creates the question that, how do we keep such such a large amount of data? In what way, or the best way to keep this data? The variety creates the question that how do we make this data very fast accessible to people, because it should take a long time to do a data warehousing, put this data into a structured place. Maybe after 6 months, we make some analysis or some data accessible to a broader world. Now, obviously, as we are dealing with variety, we don't have that much time. So how do we really make it accessible in a much, much faster way than what used to do before? And the velocity, obviously, as I talked about, now question is that how relevant is your data or analysis if you really delay, giving your insights by maybe an hour. In some cases, maybe you are taking a decision at a split second. So it really, looks at technology or possibilities in a completely different way than what we used to look at probably a few years back. Moving to next, I will talk about probably one of the example of a healthcare company which is in Pennsylvania in US, and it's a very interesting company who has around 2.5 million number of patients, and they were trying to really decrease the number of times the patients are really visiting the hospital, because the hospitals did not have that many, that much of space and facilities. And they obviously, the other pressure they were always facing is patients were coming back and saying that the cost of medical management is really high. And what they really did is they went back, they looked at all the patient records, health records of all their patients, and they identified few of those high users, or the patients who are really needing frequent care, and maybe even putting a lot of cost or burden into their medical management. And they've identified few of those people, and they made them go through a virtual care management system where they don't need to come to the hospital for everything. They can be at home. There will be a lot of medical devices which might be connected to those individuals, and those devices will send a lot of information back to the central database of the hospital. And based on the pattern of such data, based on how such some of these vital numbers are really changing, somebody might be talking to them about a need of certain medication, or even if in extreme cases maybe a hospitalization. But that really significantly decreased the number of times some of these customers were really coming back to the hospital. Obviously, their overall cost of medical management went down significantly. Now, this is just one example of how big data and the data which is unstructured, which is much more real time, can really make